Hello, my name is Ashley Lowry. I'm an Indiana State University nursing student, and the topic of my presentation is professional nursing practice and the impact of healthcare policies. So, who's at risk? The population at risk are individuals who are impacted by healthcare policies. Here are the following learning objectives for the presentation. At the conclusion of this activity, participants will be able to define UNESCO. At the conclusion of this activity, participants will be able to recite the benefits of continuing education. At the conclusion of this activity, participants will be able to identify various ways to continue nursing education. At the conclusion of this activity, participants will be able to identify why continuing education is important. At the conclusion of this activity, participants will be able to define economic impacts of the Affordable Care Act. I've included a pretest to check your knowledge on the topic. Don't worry, everything will be covered in the presentation and answers will be provided at the end. The UNESCO Institute for Lifelong Learning is a specialized agency that's part of the United Nations. UNESCO's mission is to contribute to the building of a culture of peace, eradication of poverty, sustainable development, and intercultural dialogue through education, the sciences, culture, communication, and information. UNESCO objectives include attaining quality education for all and lifelong learning, mobilizing science knowledge and policy for sustainable development, addressing emerging social and ethical challenges, fostering cultural diversity, intercultural dialogue, and a culture of peace, and building inclusive knowledge societies through information and communication. Healthcare is always evolving. Therefore, education does not end after graduating from nursing school. In fact, the professional nurse is expected to continue education throughout their nursing career. The use of continuing education will lead to increased quality of education, development of nursing competency, increased critical thinking and problem-solving skills, increased quality of patient care, improved patient outcomes, decreased mortality rates, and a reduced chance of errors. Forms of continuing education can be formal or informal, and there's a number of ways to do so. Enrolling in traditional or online programs, attending webinars, attending conferences, joining a nursing association, obtaining certifications in certain specialties, on-the-job training, researching and reading nursing journals, articles, and evidence-based literature, collaborating with other healthcare professionals, and volunteering on committees. So why is continuing education important? Most patients and their families demand exceptional care. Although many patients do educate themselves about their conditions, the nurse is still expected to know more about the diagnoses, procedures, and treatment options. Effective leadership requires the nurse to have knowledge in certain trends in healthcare and innovative technology. As the nurse's career progresses, what was learned in nursing school may be obsolete, and experience while working may not be enough education to keep up with rapidly evolving trends. The nurse may also feel more confident, which helps improve job satisfaction and employee preservation. And it may help the nurse earn a higher salary. So this is my personal lifelong learning plan for continuing education. I plan to obtain subscriptions to nursing journals to promote research and reading evidence-based literature, attend webinars offered online, join the American Nurses Association, joining other nursing associations that are specific to my specialty and those that I have an interest in, such as Emergency Nurses Association and travel nursing. Obtaining certification for Certified Emergency Nurse, the CEN. Always be open and accepting of constructive criticism, and participate in trainings that are offered by my employer. So now we're going to dive a little deeper in one of the healthcare policies that's called the Affordable Care Act. The official name is the Patient Protection and Affordable Care Act, but is commonly called Obamacare, ACA, or PPACA. It is a healthcare reform that went into law in 2010. It created a federal marketplace where people can buy health insurance plans that are provided by the government. It has three primary goals: make health insurance more affordable, institute consumer protections, and increase the number of people covered by health insurance. So 10 changes that were instituted by the ACA include: it required all health insurance plans on the Obamacare marketplace to cover at least 60% of all medical expenses, required all ACA-compliant health plans to cover preventive health services and 10 essential health benefits, divided health plans on the marketplace into 4 tiers based on the cost sharing split between customers and the insurance company. These are also called metal tiers because of their name. They have gold, bronze, platinum, and silver. Created health insurance marketplaces, also called exchanges, where people can compare and buy insurance plans. It established the individual mandate, a penalty for not having insurance. This has been indefinitely suspended since 2017. Extended young adult coverage to age 26 on family plans. Provided health insurance subsidies like premium tax credits and cost-sharing reductions to make health insurance premiums more affordable. Guaranteeing coverage of pre-existing health conditions. Ended lifetime limits on coverage. Created a review process for premium increases, forcing health insurers to publicly justify rate increases, and expanded Medicaid and CHIP to more low-income families. Here I have listed some economic impacts of the ACA. From 2009 to 2015, there was a cumulative economic growth of 13.8%. There was a decrease in unemployment rates from 9.9% in 2010 to 5% in 2015. Nearly 14 million more jobs were added to the private sector during these years. It's an increased productivity of employees, reduced healthcare spending per person, tightened provider payment rates, introduced incentives to reduce excess costs, reduced the amount of uncompensated care that hospitals provide, doubled federal funding for community health centers, which provide care to 26 million Americans. However, ongoing economic, political, and sociological questions remain about whether the size of healthcare workforce and distribution across healthcare occupations and geographic locales will meet patient needs in the future, and how to reduce disparities in access across income, race, ethnicity, and other demographic categories. The future of the ACA is unclear. There have been multiple challenges in court with attempts to get the law repealed. Specific challenges include the individual mandate and Medicare expansion. And like I stated previously, the individual mandate has been indefinitely suspended since 2017. This can be overturned in the future. There's been decreased funding for open enrollment advertisement over the last few years. There's been an increased promotion of short-term health insurance plans instead of government-provided plans on the marketplace. However, short-term plans do not offer the same protection for consumers, and they may leave Americans without the healthcare coverage that they need. Here are the answers to the pretest. Let's see how you did. Here are some additional resources.